And we want to be very sensitive to our time today because many of you may have to get back to your virtual offices. So without further ado, I'd like to introduce Bridget Wilson, President of SHRM-Memphis.
Good morning, everybody. My name is Bridget Wilson, and I'm President of SHRM-Memphis. It's my pleasure to welcome you all to our May monthly meeting. I do have some quick reminders and also some updates. Please make sure, if you have not had a chance, to go to our COVID-19 resource page on SHRM-Memphis. We have tons of information on there that we update daily. So please make sure you go out and check that information out. Also, we also have a new LinkedIn page on our on LinkedIn. The page is where you don't have to request, you just follow us. So make sure you reach out and follow us on LinkedIn. And of course, we could not have any of our meetings if it were not for our wonderful sponsors and our signature sponsors. And this month's sponsor is Pew's Flowers. Now I have the pleasure of introducing Cindy Effenoff, who will do our legal update. Thank you all.
Can you hear me? Great. Okay. Good morning, everybody. There's some real interesting stuff going on with the return to work in light of the fact that we're now in phase 2. And so what's happening is we're getting a lot of questions about what if the employee does not want to return to work. First and foremost, if the employee fails to return to work, absent a really good reason, then they lose their unemployment benefits, both state and federal. The more important question is, what if the employee, as part of their determination not to return to work, says, I am concerned about my own safety? So that's important, and there's a reason that that's important. Obviously, for any employee to return, the employer has the obligation to ensure a safe workplace. So that means that you're going to have masks, and you're going to have hand sanitizers, and you're going to have done some deep cleaning and make sure that everyone is reasonably safe. But what if you still have someone who says, I'm afraid to return? Well, the EEOC just issued some guidance on that. It was their third guidance that was issued in about a 2-week period. They actually issued some guidance and then rescinded it and then turned around and issued it again with a little tweak. And that guidance came out May the 7th. And what it says is, if you have an employee who says, I'm afraid to return for my health, perhaps they're an older individual, perhaps there's someone that has an underlying illness, perhaps there's someone who's had an organ transplant, they have an immune disorder, something that would cause them to be ultra sensitive to their safety, their health. You have to look at that individual. If they ask you, you have to look at them on an individualized basis, and you have to assess their situation, and you have to determine whether there is a reasonable accommodation that your organization can afford them that would mitigate the potential damage to them. We all know that you cannot put them in a bubble and absolutely ensure that there will not be any kind of health risk to them. But you can mitigate to a certain extent. And that would mean if you have someone who routinely would come into contact with the public as part of their job, can you shift them to a job where there is less contact? Can you, change them into a different position and make it so that much less of their duties involve actual contact? That's one possibility. Once again, though, if you make that offer and you attempt a reasonable accommodation, if the individual fails to accept that and still refuses to return to work, unless they have been told by a physician to self-quarantine, or they are in the process of actively seeking a COVID diagnosis, then they will lose their unemployment benefits. So that's really important to understand, but it's also important to understand that you cannot step forward if you have an employee that you're concerned about. If you think, oh, you're older, or, oh, I know you've had some lung condition, you cannot volunteer. You cannot say, guess what, I'm concerned about you. let me step in and substitute my judgment for yours. If that employee is willing to return to work, you cannot kind of step on their toes and say, I don't think you should come to work in this fashion. And the problem there, of course, is that the ADA gives you the potential of blundering into an area where you really don't need to blunder. By the same token, you've got to be very sensitive to that individual. And if that individual would like some sort of assistance, if they raise any of those trigger words that would make you think, okay, this is going to be an ADA issue, or maybe we should extend some FMLA leave to this person, then that's you're required to notice that. So that should take care of it. If you have questions, you know, we're all out here working now. Everybody's going back to work, so feel free.
Thanks, Cindy. Great update. And as Bridget mentioned, on our website, we do have a resource page for COVID-19. Cindy will be summarizing this information and adding it to that, just like we would be at a meeting where you'd get a one-page flyer of her talk. It'll be on our COVID resource page. So look for it there. And Cindy, if you did not see on the slide, is the Chief Executive Officer for the Memphis Area Legal Services. So be watching what happens. She often is on the news. So you can say you saw her here on SHRM-Memphis. A couple of things before we move into our main program today is we want to remember all the things that we're going through. SHRM-Memphis is active in the community with our community partners. And these are 4 that we wanted to pull attention to. And we have their websites here. We want to make sure that as human resource professionals, we're supporting our community. And where we can, we encourage you to contact these particular nonprofits. There are certainly many that need our help, and our small businesses need our help and our support as well. The sooner we get small business employees back to work, you know, the sooner we begin to make a dent in our unemployment rate. So we just want to encourage you to be a part of the SHRM-Memphis community service effort and check out what volunteer needs each of these have. Our first one is Alpha Omega. They provide service to veterans, and we've had item donation for them in the past few meetings. Great opportunity to serve. American Job Center, we have some folks that work there who are on our board. Great ways to give back and to help some of those folks get reemployed. Hope Works, there's a number of ways in terms of job training to get involved. And then lastly, all of us have seen the need for more food support for the food security issue. So let's make sure we do all that we can to help these great organizations. Our restaurants are now back up to 50%. If you don't feel comfortable going out, consider gift cards or ordering out as well to get those people back economically up and running. Our program today is moderated by Christy Travis, who's the CEO of the Memphis Business Group on Health. And Cindy has been with us before and is a great resource to pull people together on the issue of health in the workplace. And one of the issues I think that we find is that everything has changed. You see that on the TV commercials, and you see that in a number of different ways. But we're beginning to look at a lot of different parts of HR differently. And one of them is what's going to change with the healthcare that we've been accustomed to. And so she has gathered together a great panel. I'm going to let her introduce them. But let's give a warm SHRM-Memphis welcome to Christy Travis.
Wow, well, thank you. That's great. I love a welcome. You can go to the next slide. What we're going to talk about today on the panel discussion is really trying to take a look at what health benefits are going to look like after COVID-19, and really, I should say after the quarantine, because COVID-19 will be around for a while. So if you can go to the next slide, please. So this is what we're going to do today. One, I'd like for you all to think about what has really changed because of COVID-19. We all know that our personal lives, our professional lives, and the lives of our friends, family, and colleagues have all changed significantly. Two of the most important ways that have changed since COVID-19 is how your employees actually experience their benefits. And as we know, so many more people are working virtually from home, they're remote. You've now got challenges that maybe you didn't have as much of when they were in one place or in an office location or a manufacturing location. So their experience with benefits is very different now. And as Kathy said a moment ago, the other aspect that we're going to talk about today is the fact that even their experience with how they get healthcare services has changed dramatically. And this is really important for you as HR and benefit professionals to keep in mind, because you need to start thinking about the implications for how your employees will access services, but also what your benefit designs look like. I always try to remind myself that even though the world has changed, there are certain things that are still around, and I call these old problems. And one of those is chronic conditions, especially in our community. People still have diabetes, they still have hypertension, they still have COPD. And unfortunately, because they have these underlying conditions, they're also at a greater risk of having a more severe disease if they are infected. We can't lose sight of the fact that we still need to be paying attention to what I'm calling those old problems. But the new challenges that we have are certainly ones that we need to pay attention to as well. We know that what's it been, almost 3 months, at least it feels like a year for me, that we've been in isolation really from each other, has increased significantly the emotional health problems that we have, as well as other issues related to isolation and anxiety, perhaps substance use, other aspects of that. We also know that because of the remote work, and this kind of comes back to that other need that's changed, that has created new challenges for us, especially around employee communications. So today what we're going to do is kind of focus on 3 of the health benefit strategies and priorities that we hope you will leave this meeting and go back and think about how you're addressing them in your workplace. So you can go to the next slide. And we're going to do this by hearing from and learning from 3 panelists. Sarah Green is with Gallagher, and she's going to be addressing really the well-being challenges that have been brought to light with COVID-19, but reminding us that these have been our challenges for a very long time. But we do need to think about how COVID-19 has actually escalated some of these priorities. We're then going to hear from Clint Cummins with the Memphis Medical Society. Clint's going to really help us understand how the care your employees are getting has changed significantly, thinking about telehealth and thinking about a different way, perhaps, that we need to start thinking about primary care moving forward. And then G. Von Knight is going to be talking with us about employee engagement and employee communications. She's with Red Rover Company. And she's going to really talk with us about how do we think about it differently now that some people will probably not ever return to the workplace. They may be permanently working from home. So with that, I'm going to turn it over to Sarah. Each of our panelists is going to take about 5 minutes to tee up some key issues. I would like to ask you all to use the Q&A button on your Zoom. It's over on the far right. I'm going to be monitoring that for questions. I won't be looking at the chat. So we'll try to see if we can capture some questions that might be in chat. But I'm going to try to monitor the Q&A, so please use that. And we will do Q&A kind of as we go along, so that we're trying to be sure that we're focused on the issues that are important to you. So Sarah, I'll turn it to you.
Thank you, Christy. Good morning, everyone. It's a pleasure to be here with you today, and thanks for taking the time. Because of this worldwide pandemic, it's likely that this has been the most critical time in the history of your company to support every aspect of the employee's well-being. And as an example, at Gallagher, we partner with our clients to further their overall organizational well-being strategy with a holistic approach encompassing the 5 dimensions that you can see here: career, financial, community, physical, social, and emotional. And we see investing in the well-being strategy as one important way to help the employees feel positive, but also it signals that the organization has a commitment to their overall welfare. And with COVID-19, we're seeing that employees are experiencing a lot of pressure in a multitude of ways. And that said, it really makes the provision for health and well-being vital in terms of building employee resiliency and ensuring support when needed. So a rhetorical question I'll ask you, as historically at your organization, how have you assessed that the employees' needs are being met in the various dimensions of well-being? Do you deploy annual engagement surveys? Do you leverage wellness champions and gather their feedback or conduct focus groups? Have you deployed a well-being interest survey to hear from them on what their needs and what they value? That's something we can revisit later in the conversation, but we can move along to the next slide here. And with COVID-19, we know it's impacting the whole person. As we look at career well-being, they may be worried about what type of sick time or family leave that they can take. What about physical well-being in light that they might be exposed or infected with the virus? Social well-being, as Christy mentioned, some folks, as we're seeing social isolation and physical distancing as a precaution. Some folks can leverage the opportunities such as we are today virtually, but for others on the front line, such as the healthcare, they may have to distance themselves from their loved ones for an extended amount of time. I've seen where clinical staff are coming home and setting up beds in the garage. They're finding, a certain area of the home that they can isolate themselves in, or even furthering the distance with staying at a hotel. So there's a lot of challenges that can come our way socially with this pandemic. And community well-being is influenced as many businesses had to shut down. Unfortunately, some are not going to reopen. Some are taking the necessary precautions as a phased approach, but it's going to look and feel much different than prior to the pandemic. And emotionally and mentally, I feel that we are really just at the tip of the iceberg as far as trends emerging. And as the negative stigma of mental health concerns has declined, I think that there's going to be a higher sensitivity and expectation that mental health services and tools will be provided, and there's going to be a higher importance on the perceived value of those resources. And we've seen, as we partner with our clients, more traction with organizations hosting mental health first aid training for their supervisors. And this really is an opportunity to upskill the supervisors so they're better positioned to understand the employee, empathize, and even detect signs and symptoms so that they're readily, really confident on how they can best support the employee during that time. So with that, the last dimension of well-being, financial, we can read the Wall Street Journal and see that this is the biggest downturn we've seen in the history of our country since the Great Depression. And, we'll see the employees are being impacted as far as some employer groups are losing business and customers. Some employer groups, unfortunately, have had to conduct furloughs or layoffs and even maybe reduced hours or salaries. And so employees are facing new financial challenges as far as looking at their daily expenses and budgeting. I'll pause there and I'll turn it back to you, Christy.
Well, thank you, Sarah. It certainly tees up a lot of very important issues that even though we may have been thinking about well-being in these 5 categories, COVID-19 has certainly impacted them. So thank you for that. And we'll dig a little deeper into it later. I'm now going to ask Clint Cummins with the Memphis Medical Society to kind of talk a little bit with us about how the care that your employees and their families are getting has changed due to COVID-19, and maybe tee up some of the issues that we need to think about as HR professionals. So, Clint?
Thanks, Christy.
Clint gets started. Let me just remind everyone to use the Q&A. I've been asked to make sure you know to submit your questions early, and like we do in voting, vote often and frequently. So please make sure you're sending questions in for our panelists. Thanks, Clint.
Thanks, Christy. Thanks, Sarah. Thanks, everybody. And thank you to SHRM for having me today. So I want to give just about 15 seconds of background on our organization. So the Memphis Medical Society is a professional association of physicians that runs the gamut of specialties. It runs the gamut of career stages. We have medical students that are members, and we have retirees that are members, and everything in between. There's about 2,300 members total. And as you can imagine, the lives of our members and our organization has been turned upside down in the last 2+ months. And if you don't need any more evidence, you can look over my right shoulder. I'm sitting in our, what is normally our conference room, and where those boxes sit, you'd normally see physicians sitting there conducting some sort of meeting in our office, but now there are N95 masks in boxes there, as we've been able to help some of our members get the PPE that we need, or that they need. And so that's have mixed emotions about those changes, as I'm sure many of you do with a lot of things throughout this pandemic. You know, healthcare was already in the midst of this digital modernization before all of this even started. But many providers could still hang on to what I would call just non-digital methods. You could kind of get around not needing to access things like telehealth to take care of your patients. But COVID-19 has changed that for all of us. And now our providers are really forced into that modernization. And I think that's going to be a good thing. Next slide, please. So telehealth, obviously, it's been a major disruptor or innovator, whatever term you want to use. You know, again, our providers were able, you know, to get by, many of them without adopting this technology early on, but they had their hand forced during the pandemic. So a few things about telehealth. It got more local for sure. The adoption of this by Memphis area physicians has increased dramatically. Many of your employees, for folks that are listening in, you know, they can have virtual visits with their own doctors now. They don't necessarily have to use a third-party platform and talk to someone who's in Maryland that may have a license in Tennessee. So it's certainly made accessing their own physician a lot easier, both for them and the physician. And that's my next point, is that it got easier. You know, I can't say that I ever imagined a world where Skype, Zoom, and FaceTime would be used to conduct patient visits, but we're there. A lot of you on the webinar have probably interacted with your physician that way. My 72-year-old mother just underwent a hip replacement, and she had probably her first video conversation ever, and it was with her surgeon. So that's the world that we're in. It certainly made it easier, but it's also made it harder. Those tools that I mentioned don't necessarily integrate into EHRs and EMR systems. And then if you use a third-party tool, like many of you have used, they might provide integration, but it's going to come at a greater cost to the provider that uses that technology. We were actually beginning to work with a telehealth provider statewide as the pandemic rolled out, we were going to roll out a solution for our members, and the company went out of business because of the pandemic. So even some of those organizations are enduring some hardships during all this. So I want to talk a little bit about the future of primary care. So we're partnering with the Tennessee Medical Association on a survey of our members. We're still in the midst of it, but the early returns already suggest a significant financial impact, which shouldn't come as a surprise, but it's due to that delayed routine care. Practices are laying off staff, and the Medical Society, as a sidebar, actually owns and operates a staffing agency called MedTemps. And we saw the brunt of those staffing shortages, as well as our hours were cut. Our billable hours were cut in half almost overnight. And so we were seeing some of that residual effect from the practices being forced to lay off. Out of that, as I alluded to earlier, did come an opportunity. We staffed our first non-medical entity because many employers are now checking temperatures when employees enter the facility. So we were actually able to provide an employee for a local company that wanted to do that. So we're also in the midst of really researching what the future of care in general, but even primary care is. And, you know, that leads me to my last bullet. You know, I think it all begs the question, should a primary care and care in general be more direct and more on site? Are these new models going to ensure that we have a functioning, effective primary care system? And that leads into the next slide. So the employer provider considerations, you know, HIPAA compliance is something, you know, everybody's always aware of, but, you know, one of the thoughts that I had is, you know, going forward, if this pandemic continues to extend and we want to be able to provide more direct, easier ways for folks to access their providers, you know, do work sites need to have a room for employees to be able to have private conversations with the provider? Is that a service employers should be providing? You know, it would allow them to not leave the premises, obviously, and it would allow, assuming the room is private, it would allow for them to have, you know, really private conversations. It could be converting a break room or, you know, some other unutilized office during this time. So I think those are the types of things we're going to have to be considering going forward, both from the employer aspect and from the provider's aspect. And the other question is how do we make care more convenient? I mean, that's this whole digital modernization. It's all in the spirit of making care easier and more efficient. So, you know, taking it another step beyond the, you know, room at the facility where you can have a private conversation with the provider. Can we bring the provider on site? I don't know how many of you are old enough to remember, but doctors used to make lots of house calls many years ago. I think Christy's dad was a physician. He may have made some house calls in his day. So, you know, can we do company calls? Is that, you know, something we can do? You know, we're accustomed to, you know, on-site providers at, you know, typically larger employers, but is there a way to bring a physician or nurse practitioner or a PA onto your site 1 or 2 days a week? Is that something we can look at? And those are, you know, again, things that our organization was not looking at prior to the pandemic, but we are taking a really hard look at what the future of care looks like and how that impacts, you know, both the patient and the employer. So that's it for my slides. Christy, I'll turn it back over to you.
Sure. Well, thank you, Clint. And I know that, as Clint mentioned, many of us who are attending this webinar today may have actually had virtual visits. And so think about how that visit went for you and kind of connect it with what it means for your employees and their families. And think about, you know, how you want to reinforce, if you will, the availability of virtual, but still recognizing that at times in-person is really going to be what is needed. So I really appreciate how Clint kind of teed up some of the future of what care is going to look like. And we'll try to dig a little bit more into that as we get into our moderated discussion. So I'm now going to ask G to really talk with us about the importance of employee engagement and employee communications, because that's kind of an underlying theme that's affected both in the well-being environment, but also thinking about how care is changing so that employees feel like they have the knowledge that they need and the understanding that they need in order to navigate this. And I'm also just going to remind people before I turn it to G, to put some questions in the Q&A, because after G's through, we are going to start a discussion, and we would love to be able to work your questions into that discussion. So G?
Thank you, Christy and SHRM, for inviting me to join you this month. On the surface, I'm perhaps the odd one out, and you may be wondering why a sales and marketing strategy company is at your monthly meeting. Go ahead and move to the next slide. I'm here to put a lens on internal marketing on our conversation. What is internal marketing? And I bet it sounds expensive, is probably the thought going through your head. Companies right now spend a lot of dollars on the strategies and tactics used to connect with their customers. And there are these complex customer journeys, from awareness to research, justification, purchase, adoption, and then the holy grail, turning your customer into an evangelist or a raving fan. Why isn't it more common to use the same strategic thinking on how we speak to and share information with our employees and staff? We spend all the time research and building benefits packages that we believe will contribute to the happiness of our employees. Why do then we often leave them with a Word doc of instructions and hope they're able to navigate the path from research to adoption all on their own? Is the customer and employee journey really all that different? It's not. And we're not talking apples to apples on budget, as your customer base is quite a bit larger than your employee base, but it actually doesn't take equivalent dollars to deploy equivalent strategic thinking to internal communications. Go ahead and move to the next slide. One of those that you can tackle that's easy to jump into with a low commitment to cash is increasing digital interactivity. Another buzzword for this is experiential or immersive, and no matter what fancy word somebody's throwing at you, in the end, we're all talking about active participation. Now, we are all guilty of the PowerPoint presentation. It's the easiest way to put information together. It's the easy way to present it, but I'll let you know, and a little secret is that when you put up a PowerPoint presentation, people are subconsciously told that they are being asked to passively consume the content and then judge it. So they're literally being signified to not participate in the meeting because they're being told to sit back, passively consume, and then form their own judgment upon it. So it's really hard to pull people into that active participation space. And there's a lot of tools, both low cost, no cost, ones that you're using that you can maximize, whether you are screen sharing a Google Doc where you've got 10 people in at once, where they're using live polls, which are popping up everywhere. There are live whiteboarding solutions. You know, I will warn you that the whiteboarding solutions are pretty clunky right now, but they're getting better by the day because of all the competition we have in this space right now. And Zoom's update that came out about 2 weeks ago, released breakout rooms. So you can take a room, you can take a staff meeting of 50 people, and within like 4 clicks, break them all into groups of 3 to have their separate conversations, and then bring them all back against their will, actually, to the main room when that conversation is done. It's a lot of fun, and it's a lot of way to just shake up the energy in your space. And in the end, it isn't about being cool or trendy. It's prioritizing the retention and adoption of the information over a checkbox approach, because the true goal of the benefits is that we support the health, wellness, and balance for our employees. So we want them to adopt them. And unfortunately, there's the opportunities. We have to work consciously harder right now because we are trying to fill that gap of the shoulder to shoulder style of collaboration that we're all missing. So go ahead and jump to the next slide. In the end, the big question is why? And the answer there is that employees are marketing, and this is outside of the company. There are no barriers today in where information is shared and reshared and talked about and collaborated. Brand sentiment today is not just what your customers are saying, it's what your employees are saying as well. And you can definitely try to hold on to that slippery beast through NDAs and confidentiality agreements, but Often the flow of data is just not within your control and near impossible to control, because all humans are looking for other humans to say something that validates what they're feeling inside. And when they find it, it can be a perfect match to light a perfect firestorm, positive or negative. Case in point, in 2017, an engineer at Uber penned a 3,000-word essay on Medium about the sexual harassment and conditions of working at Uber. Her essay set into motion a series of events that led to the removal of the CEO of the company, the termination of 20 or more other employees that were involved, and a huge ceding of market share to their rival Lyft because of a groundswell of public reaction. It's an extreme but incredibly effective example of how employees are just not expenses on the bottom line, but marketing channels that affect the top line, both good and bad.
Well, thank you, G. There really was method to the madness of putting this panel together, because the engagement of your employees is really a common theme around the other two panelists as well, especially around well-being, as well as thinking through the healthcare delivery system and the new world that your employees are probably operating in. So I appreciate G kind of pulling it together for us, because that's extremely important to think about how you're engaging with your employees. So we're going to move now into an open discussion, moderated panel discussion. Please remember to post your questions. I can't imagine that you don't have some, but we will start that conversation now. And I'm going to kind of pose a question to each of our panelists to have them dig a little bit deeper, perhaps, into some of the concepts that they referenced in their opening remarks. And I'm going to start with Sarah. You know, Sarah, I was kind of really intrigued a little bit about the fact that you mentioned mental health first aid at work training for employers. We actually did a group HR and benefit professional short version of that training back last year. And maybe you could speak a little bit more to the value of the frontline supervisors and the value of people at the employer being versed in the aspects that they cover in mental health first aid.
Sure, thanks, Christy. You know, as we look at the front line and healthcare workers facing trauma every day, in an interview I watched a nurse that was in New York, and she shared that it had completely robbed her of all joy. That's a pretty powerful statement. And she also shared during that interview that there was no boundary between home life and work life anymore, with the fear that she was carrying the virus home. And so that made it more real to me, not being working in the front line. And I think we can see this extreme trauma that they're facing day after day in very long extended shifts. You know, there's a burnout component, the compassion fatigue component, where it's causing a lot of frustration, anxiety, depression. The list really can spiral down quickly. And so the key really is getting in front of it. And what are we putting in place as preventative measure? So in 6 months' time, you know, what's happening with our workforce emotional well-being is going to be critical to their performance. And so as we look even with the trends, there's more reporting on suicide right now. There's a lot emerging around that. And there's another, I know I mentioned the mental health first aid, but there's also medical professional mindfulness programs that are research-based. And it's a proven methodology where that healthcare worker can take a moment, maybe it's 1 to 2 minutes, and get on the app, go through the 2-minute guided mindfulness approach, and it can reduce their stress at hand. It can reduce their anxiety. And that said, it's going to allow them to have higher levels of concentration, higher levels of work performance, and prevent error. And we look at healthcare, prevention of error can not only be costly, but it could be deadly. So providing ways that they can, better concentrate and work.
Well, I think that's a really good point that you raise. And I think looking at the tools that employers have in place, mental health first aid training is one of those, the mindfulness apps that employees can actually use themselves, being sure that you have some way, and your description of what goes on for maybe the healthcare workers that are on the front line is probably not unlike what goes on for other frontline workers. We know that we have a lot of businesses in Memphis that were declared essential businesses, and they've been operating, and they're in direct communication, touch, other things with the general public. And so I think that they would have a similar reaction as that nurse, in that, they have the concern of being infected, passing it along to their loved ones, and at the same time having to focus on their work. So I think the mental health component is something that I know most employers have been at least considering, and so thank you for those comments. We do have a question that I thought would be great to kind of share right now. The questioner says, we've been talking about helping employees as they return to work, but many will continue to work remotely for months to come. What can we do to track employee well-being and offer them help? So I'm going to kind of tee that up for both Sarah and maybe G, to give some thoughts around working with remote employees that are going to still continue to be doing that for some time. Any brief thoughts that you both have on that?
I'll start with a couple comments. One is you need to centralize a listening channel for your employees if they're still remote. If that's established, that's a consistent way to get the messages out, but also to funnel them back in, and maybe put together a FAQ for those frequently asked questions, and provide updates on a weekly basis or a cadence that's a best fit for your culture. So knowing that there's a way that their voice can be heard if they have a concern or a question, that there's one way that they can access you outside of just individual emails and phone calls. As far as like how you can track well-being, there's a variety of ways, but I'll just give an example. At Gallagher, we championed around a well-being challenge given the remote situation, and we took a holistic approach where we had a tracking card, and we were to complete an action item under each dimension of well-being. You would choose one each day. As we know, habits can form in 21 days. So rallying around that, we use Qualtrics as our partner for surveys, but we submitted a weekly survey for the employees to report on their completion of items. And then each week, the branch managers were able to communicate back the results. And it made it a kind of a fun, friendly competition because we were tracking each area as a region. And so we could see the tally and the scores along the way.
Well, that's great.
Just one idea.
Gave you some structure, plus made it a little bit fun and competitive. So
Yes.
G, do you have some thoughts around that question as well?
Definitely adding to that, there is nothing wrong with systematizing how you care about your employees. So if you have a weekly, a monthly check-in, definitely add a checklist for the questions that you want to ask them, to check in with them. It doesn't have to be a spontaneous question that you care about them and want to check in with how they're doing. It can be something that it's going to happen every week, and they anticipate that you are going to want to know how they're doing, how they're managing their space, how they're unique situation because everybody's home is a unique situation. So it's not a one-stop cookie cutter type situation. Just sharing sharing a personal anecdote. I'm actually brand new to Memphis. I got here in February to start a brand new job that I was super excited for in a brand new city. And that was when the world was pretty darn normal. And it quickly became not normal. And my family is actually still back in New Mexico. I've got 3 kids and my husband. They're in our house back in New Mexico. And it was going to be, you know, go to a brand new city and get excited and find a way to set up home. And then the world changed. And my boss intuitively wanted to make sure that in this extreme time of stress, you know, being separated from my 3 young children, that, you know, what was I doing for myself to make sure that I was balancing it? And what was I doing to take care of myself? And was there any, you know, risk of me losing my joy week over week in managing that? And so we added it, you know, to our weekly one-to-one agenda. And it doesn't make the question any less caring. It actually makes it more top of mind, that I know that my employer is investing in making sure that not only can I show up and be on all my Zoom calls and all my Slack channels and answer every email, but that I'm actually happy and healthy to be there at the same time.
Well, I really like the importance of being you customize it based on what people's needs are. And I think that's really important that we stay in touch. I mean, I'm a small employer myself. It's me and a part-time assistant, and I've been challenged with, you know, being sure that we find a way to communicate not just by email and text, to G's earlier points in her comments, because that's not an interactive conversation. You know, you drop it, it's yours now. I gave it to you. So I think those are really important aspects that we need to think about now. You know, Clint, going over to you, you know, you mentioned my dad was a doctor, and he did make house calls, a lot of them. Still have his black bag upstairs in the attic. I hope there's nothing in it that was supposed to go bad. But anyway, you know, I'm really struck by the significant difference on the telehealth. I think I shared with Clint an article that got me interested in this very concept, because all of a sudden physical therapy was being done here in Memphis with orthopedic practices. They were doing physical therapy with people at home. I knew about, you know, basic primary care perhaps, but can you talk a little bit about some of the new aspects of telehealth, like, you know, the specialties that may be doing some telehealth that we might not be thinking about?
Well, you know, as far as who is using telehealth, our information suggests is that it runs the gamut. I mean, you know, specialties like dermatology were using it all along, but particularly when you talk about follow-up appointments, that is not exclusive to any specialty. You know, your example about physical therapy in the orthopedic space, not to point fingers at them, but you know, it's funny what a pandemic will do to you. It forces you into things you should have been doing a long time ago. I mean, there are a lot of those type of appointments that can be accomplished with telehealth. Now, the barrier there historically has been reimbursement. And so that's another space that, you know, has been disrupted during the pandemic from the provider standpoint in a positive way through, you know, executive orders from the governor and some changes at the CMS level. So then that begs the question, well, those going to hold on after all this? And, you know, my answer is that they need to. But, you know, we hear stories every day about different specialties, and really it's, just to be frank, it's the 70-year-old physician that is using it for the first time, and he can't believe it and you can't believe it. And it's really, it sounds a little cheesy, I guess, but it's exciting to actually have a conversation with them. And they're like, I'm doing a telehealth visit and I'm ordering PPE myself online. I can't like fathom that I was ever able to do this. I'm like, you know, I wag my finger a little bit and say, see, we were telling you all along how easy it was if you just put some effort into it. And I think those, temporary closings of offices also had that effect. It gave them time to research other things that impacted their practice. And I'll give it a little funny anecdote. One of the things that spare time allowed for is, you're on a call with, say 20 or so physicians, and their multiple specialties represented. I had an internal medicine doctor tell me you should know that it's a sign of a pandemic when you've got a bunch of orthopedic physicians talking about infectious disease issues on a phone call. So, just very interesting developments that we've had in the telehealth space.
Well, I think that's a really good point. I think to a certain extent, because everything changed, it opens up a different future for us that can actually maybe be a better future. I know that I'm not always in that part of my mind, but I do think that we're going to see some positive changes in the healthcare delivery system. When I was doing a little bit of research for this, I noticed, Clint, that Blue Cross Blue Shield of Tennessee has made virtual visits within network providers permanent.
Mm-hmm.
Right now, through June, there's no cost share with the member, but after June or after some time, they've extended this already once, no telling, it would be subject to normal cost share. But, I think that is a sign of the times, when Blue Cross Blue Shield of Tennessee makes it permanent. And so I do think that we'll be seeing a significant change around telehealth. There are a couple of other questions. Thank you guys so much. I'm kind of scanning really quickly. One thing I want to let you all know that you've already got them actually in your email. Both G and Sarah have provided you with some tools where you can do some assessments, one around your well-being programs and one around your internal communications. So I want to thank them for doing that, and you should have an email from SHRM-Memphis because a question came up about that on the list, and I just wanted to let you all know that is in your email. One question that I think is somewhat interesting here is that what's your take on the reference to the new normal versus language around pandemic, because pandemic seems to escalate stress. So, G, do you have any thoughts around how we use language in communicating about this with our employees?
Language is incredibly important. You do not want to create more fear than what is reality at the time. However, there is also the ability for great innovation to come out of times of stress, which we're seeing across the board with businesses as they start to innovate. There's a very fun meme that tries to reframe something like this that says, what is responsible for your company's digital innovation? And A is the CTO, and B is the CIO, and C is COVID-19. Because as humans, we all innovate when we're pushed back into a corner, and we try to really reframe language around that. It's around, who is finding solutions right now, who is pushing towards innovation, what empowering our staff to come to us to say, how do you need to create your workspace in a way that works for you so that you can be productive, because as a company, we're not going to go into your home to create that workspace for you. And a lot of really wonderful things are coming out of that, with people having, ownership and buy-in and being part of the solution rather than just waiting for somebody to hand them a golden ticket or, a turn back the clock dial. I probably a month ago, I would have bristled at the new normal. Language changes so fast these days. There is an acceptance that it's not that entirely working from home in the situation that we're in right now is not the entirety of the new normal, but there is an acceptance that we're not going back into the exact same workplace. A lot of things that have changed and shifted, the adoption of e-commerce, the adoption of digital tools are not going to 100% scale back to where they before. So it is accurate. It just depends on, how you phrase it in a forward thinking headspace for your staff.
Well, I like the idea of the forward thinking headspace. I think we are coming out of our kind of isolation. And the way that I've looked at it, this is just me personally, is that, I've got to learn to kind of live with COVID versus hide from it. And so I've got to kind of get my quote unquote new normal, and some of that's fear-based, but some of it's very practical, so we're kind of in that transition phase. So thank you for your thoughts on kind of how to articulate some of that with our employees. I did get a question about EAP programs, and the questioner, I think, really sizes up EAP very well. How do we ensure that our employees know what they can use the EAP for? Secondly, are there any new ways to use the EAP program during this time? One of the challenges that we've had with EAP for a very long time is that it probably is not reaching as many employees as it could. Any thoughts, Sarah, around EAP and how maybe you work with some of your employer clients?
Sure. So the EAP is a challenging area as far as utilization. I often see that it's underutilized, and I would kick this off to G as far as, have you identified the most effective way to communicate the resources that you have in place today? And a practical example I'll give is I was supporting a client that reached out and they said, we want to go to market, we want to conduct a formal RFP and find a better, more comprehensive, more robust EAP. We're fielding lots of questions from our employees on wanting more mental health resources. And at that point, I paused and I wanted to get a better understanding of why and what the goal behind it was. And as we conducted a discovery meeting, we actually learned that they had a very robust EAP that was amazing. They didn't need a new one. It was just a matter of how the employees didn't know how to access it and they didn't know how to use it. And so we actually were able to connect the dots and bring in our benefit technology expert to talk through what better technology piece do you need to make it easier for them to access this tool. And then also our Gallagher communications team, which was able to put together a comprehensive communication branding strategy that was for the whole calendar year, so that the employees were aware of it. So I think those are a couple points that are important to be aware of. And then, of course, with COVID-19, EAPs are offering more resources right now. So reaching out to the point of contact with the vendor to see what those resources are will be helpful.
Thank you. G, any brief comments?
Briefly, you got to tap into the type of learners your employees are. We often say, here's the information and you can access it, but across your company, you probably have visual learners, you have ones that are video learners, you have ones that need illustrations, you have ones that want to hear it out loud, they're audio learners, and making your communications materials available in multiple formats for the people who want to consume a little bit of information, for people who are the binge deep divers who want to consume all the information in one setting. Your entire staff is a set of mixed learning preferences, and if you're not quite getting people to understand what the program is, how it could benefit them, a real good place to start is to really look at, are you tapping into all of those learning styles, or is it just one style, and if it fits for them, then it works.
Well, customizing it, thinking about your different segments of employees and how they learn and how they can take in information to help them understand what resources are available to them, I think is very important. You know, Clint, when you were talking, the other issue that you brought up was really around primary care. And, you know, I know that nationally, I heard the other day that 20% of primary care offices have closed. And that over 42% of primary care offices have laid off staff or furloughed them. I think with the intent of coming back when, you know, we kind of begin to start thinking about our new normal and coming back for care. Do you have any feel for, and I didn't ask you to prepare for this question in advance, so I apologize, but do you think that Memphis is kind of in a similar situation? And I know it's anecdotal, but maybe do you think we will be losing some of our primary care practices?
You know, it's hard to answer right now. What I've seen in the past, really just week to 10 days, is the practices are starting to open back up. You know, I got a couple of red alert calls during it. And, you know, I think most providers and even primary care ones were able to make ends meet through either, you know, PPP loans, like a lot of people on the call are familiar with, or HHS and CMS came out with some advanced payment resources for providers. And so they were able to tap into some of those to kind of make ends meet while their loan was processing. So my experience in Memphis is that a lot of those folks have been able to hold it together. My concern, and I'd say over the next 2 months, my concern is what's the safety message that we're putting out in the community? What's, you know, I think, and this isn't exclusive to Memphis, I think we were so scared in the beginning that that's the communication that was put out there, when in fact, you know, what we're trying to walk back right now is it's actually safe to go to your doctor's office. It's actually safe to go to the ER, assuming you're doing it for the right reasons. Hospitals and doctors' offices have put in place, you know, the highest level of safety measures that they can. I mean, they take that very seriously. And I think that's where we've got to start turning our focus as a community. I think that definitely alludes to the previous question. You know, how do we put a communication out there that is that tells the public what it's safe to do? We're putting a lot out there about what it's not safe to do, and we're putting a lot out there about the precautions that people are taking. But can we change that tone a little bit to it is safe to do this, or it is safe to do this in that manner? I think that is going to have an impact on a lot of things, but it's going to have an impact on primary care because, you know, there's still only so much that a provider can do through telehealth. And, you know, that's one of the few, I guess, complaints that I've heard other than the obvious throughout all this is just the length of conversations that providers are having to go through in order to just convince someone to come into the office and that it's safe. And so I think there's some work to be done on the communication side of that.
Well, and you know, maybe that's something we can talk about. How do we collaborate on, Clint? Because I think that to G and Sarah's point earlier, getting that message right, it kind of takes us away from the scare part to the new part, which is it is safe and the steps have been taken. I think that's a really important aspect for us to think about. We've had a question that's come in around high deductible health plans. And, you know, I think that it is pretty evident that for a lot of health plans, a lot of employers, their 2020 costs may actually be potentially even lower than 2019 because of all of this delayed care that is being that has happened because people have been in social isolation and because of some of the fear. But we are expecting, and this questioner brings it up, that there could be anywhere from a 9 to 15% increase in 2021. And one of the concerns, if you have a high deductible health plan, is the financial burden that that puts on the employees from that perspective, having to meet those high deductibles. You know, one of the things I think it would be interesting, and you know, Kathy, maybe SHRM can actually think about how to do this, is to think about strategies to understand how employers are going to react to that. We just ended up having a national survey about returning to work, but it didn't really focus on the benefit design. And our Memphis members participated in that national survey. So, you know, I want to say to the questioner, I think this is a really good question. I'm not sure we're prepared today to answer it totally, but I do think that there are strategies that employers are going to need to think about in terms of being sure that their employees get back into that normal way of interacting with their physicians and getting the preventive services that they need, as well as the chronic care management. So maybe that's something that we'll think about how we could structure a more detailed question around that. The other comment that was brought up is that someone wrote in that they work for a bank and the frontline tellers are, you know, opening the 1st of next month. And, you know, there's some concerns about their safety and, you know, whether or not masks can be required for, you know, workers and or customers. Sarah, I know that you gave an example really of kind of a frontline worker. They were a healthcare worker, but here's a great example of a frontline worker that's in a bank. And, you know, you serve whoever comes up to you and you need to meet their needs. Any particular suggestions that you might have on how to actually help the frontline worker feel more comfortable?
Well, first, communicating the precautions that the organization is going to take as a whole will be important, whether if those are aligned with the CDC or OSHA. That will be one positive lever that you can pull. And then secondly, I would advise, we work closely with compliance, and we also have HR consultants that devise policies and procedures. And so leveraging, if you have a general counsel or a compliance attorney, to talk through what initiatives you can legally put in place for precautions will be important.
I think, you know, kind of bringing this back around to what Cindy said at the very beginning in her legal update, you know, I think understanding what you can do, as well as maybe what you would like to do, and putting it in those perspectives. I don't know about you all, but I saw the grocery stores change over the beginning of this pandemic, where there weren't very many precautions, quite honestly. But then all of a sudden, the plexiglass comes up, you know, between you and the cashier. It even got wider and taller over the period. With the recognition too that now they're wearing masks, the staff are wearing masks, and some of this is incorporated in our Back to Business plan for Memphis and Shelby County. And you know, I think Cindy mentioned that too, being sure that you know, we understand the precautions, somewhat to what Clint was saying as well. We need to help people see that we are making it as safe as possible for people in this environment. Of course, what that means is that you really need to be making it as safe as possible, and you know, living up to the promise for that. But I imagine that anxiety is going to be there for some time, and having the well-being resources, the EAP, the other emotional health supports, the mindfulness, I think that will go a long way, at least in letting them know that you care and that you've got some tools that they can use to help with that. So we probably have time for one more question. We don't have any queued up. If anybody wants to ask us one last question, that would be great. And while I'm waiting for that question to come in, I thought maybe I'd go around the horn, and we don't have much time for this, but I'm going to start with G and then go to Clint and then to Sarah. You know, if you had one thing, and make it brief, just one sentence that you would like people to remember most from what you've shared today, please do that. So G, I'll go to you first.
Well, my slide is still up, so it's pretty simple for me. You know, you treat your employees with the same care and strategy that you treat your customers, because the employees are the ones that are taking care of your customers, and that's going to raise the ship as a whole, whether you're talking about wellness or benefits or taking them through a really difficult time and sharing difficult information. The same strategies in care to communication that you would do for a press release or something that goes wide should also be taken for something that's internal.
Great thing for us to remember and focus on. Clint?
I'm going to take my medical hat off for a second, even though I'm not a physician anyway. I don't really have a medical hat to wear, but I'm a huge proponent of associations. I've been a member of many. I'm a past member of SHRM, I'm pretty sure, and I'm on the board of 2 or 3 other ones. And I think there was some of the questions are, what can we do? What should we do? I've read communications from schools about we're waiting on the government to tell us what to do. I don't care what your politics are. Our governmental system is overwhelmed, and organizations like the ones represented on this call, whether it's SHRM or our organization or the Memphis Business Group on Health or the Marketing Association, I mean, we ought to be working together to come up with some of these solutions when the government can't come through with them. And that, again, not a criticism on the government. No one was prepared for this, but I think associations have a great opportunity to increase safety and communications through all this.
Well, that's a great idea, and I think it shows, especially in Memphis, has a really strong association and nonprofit environment, and actually a history of collaboration. So I really take to heart what you said, Clint. I think that is the best way for us to think about it. Sarah, any thoughts from you?
I would share, experiences really bring around memories. And so using this opportunity to lead with grace and express compassion and flexibility with the employees, as we know, supporting your organizational well-being strategy really is to support your most highly valued resources, which is your people. And so really leveraging this opportunity to show that you care can shed positive light during the doom and gloom of the day-to-day.
Well, thank you for that. And, I think that I've certainly learned that personal importance to not assume, I should assume that people are doing the best they know how to do. And I need to, show that caring attitude and appreciation. It may not be the best end result, but they're doing the best they know how to do. And I think that's true for most of us. Well, we don't have any other questions. One, I want to thank Sarah and Clint and G. I think it's been a really good discussion around these topics. We knew we weren't going to be able to cover everything, but I want to thank them for joining us today at SHRM, and thank Kathy and the SHRM leadership for actually thinking this panel would be a good idea. So I'm going to turn it back over to Kathy.
Thanks so much to Christy for her leadership and getting the panelists together. And it was a great conversation. And I have a great opportunity for someone to get connected with our President-elect, David DeFore. Speaking on what Sarah was talking about in terms of leading with grace and engaging people positively, David had a great strategy. He put that in the form of a question. And I would encourage y'all to get in touch with David. He actually had sort of a Fun Friday strategy where he did everything with his folks out at the Bank of Fayette County and had them do activities on Friday, whether it was trivia related or recipe related or something that was just not COVID related. And it was really a great way. And occasionally he let the SHRM-Memphis board be a part of that. And we got excited too. So that was some creativity that David just took upon himself as HR director to put out there for his employees. And it was really a great way, as Sarah identified, to lead through grace and be compassionate. We all need to think positively. We are going to get through this, and we're going to come out stronger, and we're going to be a great opportunity for our employees to learn from our role modeling. So keep that in mind. I want to move to closing out because we want to be sensitive to your time. And the legal conference, we promise you, this is the last date you are going to see. It has been moved because of the delays to the phase 2. It has been moved to August 11th. If you have registered for April 14th, or if you registered for June 16th, you are already registered for August 11th, so yay. And we have a tremendous opportunity for you to see. I would encourage you to go to the website and look at the flyer if you're not registered. If you are registered, stay tuned because you're going to be hearing more about good things coming about that. If for some reason we are not allowed to have this in person, it will be a virtual conference, so be watching for any changes and details. But we're going to think positively, and we're going to assume we're going to have an in-person legal conference on August the 11th. So join us. Last, I don't want to forget about reminding you about our November Tennessee SHRM conference. As many of you know, SHRM did have to cancel the national conference. We will be on, rain or shine. If we cannot have it in person, I believe we're working toward having that virtually as well. So make sure that you have gone in and looked at the opportunity. There's a video that you can actually play of our keynote speaker, Bill Courtney, who's an Academy Award winning recipient for his role in Undefeated, which is a Memphis film. It's gonna be a great time to showcase Memphis. And piggybacking off what Clint said about the power of associations and the power of the ability for collaboration to mean a great deal. This is a big deal for Memphis. So come out and help us make this really a great time, not just for the HR profession, but for our city. Here we have a few last minute details on things that are happening with SHRM-Memphis. If you're new, and we had a large number of guests today, I'd encourage you to become a new member of SHRM-Memphis and join our virtual new member orientation this Thursday, May 21. You can register on our website and all the information will be sent to you. We've got some surprises for those of you who join. On June 16th, we will be having our virtual chapter meeting, and it's going to be entitled Data-Driven Workplace Strategies and Compliance Consideration as we return to work. And that will be presented by some additional guest speakers from Gallagher. You saw what a great resource Sarah was today, and they have a large component of specialists in this area, so make sure you register and join us. It will be virtual. In July, we have our HR Connect coming. Save the date, hold it, and we will have more information coming out to you shortly. Already mentioned the legal conference. Want to make sure that you know you're going to be getting an email. You got the assessments that were graciously provided by Sarah and by G. Make sure you use those assessments and get in touch with them if you have any questions. But also, we are going to be sending you the evaluation of today's virtual event. This is our first event on our own SHRM-Memphis platform. And thanks to Tyler Stegall and Sonia Walton for a great job of getting this up in a very short period of time. And they have worked tirelessly to get this going, so we so appreciate that. Our website is a resource for you with the COVID-19 resources. Our board members are resources for you. Click on the board member page and make sure that SHRM-Memphis becomes a regular stop on your virtual search of good information. We so thank you for being here today. We hope to see you in June, July, and August. And we hope that this has been a meaningful opportunity for you. So please make sure you get that survey back into us. Thanks so much. Have a wonderful week. And remember, We have a lot to be thankful for. We're blessed, and things are going to be moving in the right direction soon. Have a good day.